Everyone. It seems our panelists are yet to join. So I think it's time to start the today's webinar. So on the outset, I request all the attendees to please put on your mic on silent mode and put off your video also for a smooth conduct of today's webinar. I want to introduce Mr. George Arian, who is the director in Cuts International. George will be moderating today's discussions. George has 20 years working experience in social sector, and for last 1 decade he is in road safety, and he is leading road safety work in Cuts. So over to you, George.
Good afternoon, everyone. First of all, I join with my colleague Madhusudan in welcoming you all to this webinar. We have 6 eminent speakers who had agreed to speak in this webinar, whom I will introduce later. And also we have more than 100 people who had registered for this webinar. Hope most of them will be able to join in this webinar. Last month, we have a road safety network in India, as most of you know. We were having a national level webinar in which the Honorable Transport Minister Nitin Gadkari himself attended. And this was marking the 1 year of the Motor Vehicle Act in India. And he had spelled out the strategies for the implementation of the Act. And one of the main thing he had mentioned, India will achieve the target of reducing the road accident death and injuries by 50% by 2025 itself. We don't need to wait until 2030. So in continuation to the international webinar happened in Delhi on the 8th of September, in various states, various partner organizations are organizing webinars. So this webinar is in continuation to that. And more than the 1 year of Motor Vehicle Act, from 1st of October, the Center Motor Vehicle Rules also notified, and it is effective from 1st of October. So this webinar is also marking notification of the Central Motor Vehicle Rules. Moving forward to set the background of this webinar, few things I would like to mention. As all of you know, strengthening the law is the first step in the right direction in addressing the road accidents and the death in any country. So India took more than 5 years in amending the Motor Vehicle Act, which finally got the assent of President of India on the 9th of August. Then it took again almost 1 year for the Central Motor Vehicle Rules to be notified. But in between, on the 1st of September 2019, 63 clauses, mainly related to the enhanced penalty, was notified. And after initial hesitation by some of the states, most of the states started implementing the same as well. So that is the position of the law and the rules. When we are talking about the road safety, the number of accidents and the death is still a big concern. As per the National Crime Records Bureau 2019 records, about 437,396 road accidents had happened, in which 439,262 people were injured and 154,732 people lost their life as well. And some of the major reason out of this, 38% were involving the two-wheelers, and two major reason mentioned is about 59.6% is due to overspeeding and 25.7% is due to dangerous and careless driving. So this is the 2019 scenario we have. But after the enactment of the law, amendment of the law, as per the minister statement in Indian Parliament on 19th of March, there was a 10% reduction. That the reason it is mentioned, the initial fear of the people, because of the enhanced penalties and all, but that is the positive sign we can see. And looking at this year, within the first 6 months, there was a 8% reduction in the overall road accidents, mainly the death, comparing with the same period in 2019. So we could save 23,000 lives in the first 6 months. But we can't say it is the impact of the law, because initial 3 months and the remaining 3 months of this 6 months was a lockdown period mainly. The restriction of the vehicles were, the vehicle movements were restricted across the country and all. When we mention about the lockdown, the scenario should have been there, should not have any major road accident. But again, the study shows that even during the lockdown, 140 people lost their life, and about 600 major accidents were reported during the lockdown in India. Out of this, almost 30% was involving the migrants walking back to their state, met with the accident, some vehicle ramping into them. Second was the buses sent to pick them up, met with the accident. And more than that, the interesting thing, when there was no vehicle on the road, mainly, 57% of the 600 major accidents reported during lockdown was due to overspeeding and rash driving. People were simply driving in the opposite direction. There is no traffic police in the junctions and things like that. So it is linked, and the lockdown protocols also were not having any specific guideline related to the road safety. One more thing, as India, the entire world is affected with the pandemic, and all countries are taking the precautions to deal with the pandemic. And India so far had lost more than 100,000 people. 1 lakh people had lost their life. And comparing with many other countries, our death rate is only less than 2%, 1.5% around that. But at the same time, in road accidents, we are losing 1.5 lakh people every year. But comparing with the pandemic, why I am saying is, now we can see on the road, people are wearing the mask, but no helmet is there. So people are afraid of the pandemic, but not that people, losing their life, especially the youngsters on Indian road. Setting the background of today's discussion, I had mentioned a few of these, the data and the background. Mainly, we want to, mark the enactment of the law and notification of the rule. At the same time, we want to discuss how to move forward and what are the challenges in the enforcement of the new provisions, and how we will achieve in reducing the accidents. And that is the main purpose of this webinar. To begin with, for the opening remarks, I'm extremely happy to invite the Secretary General of CUTS International, Sri Pradeep Mehta. He is for the last several decades involved in road safety. During the 1990s itself, one of the CUTS study resulted in the establishment of the National Road Safety Council. He was a member of the National Road Safety Council, and even one 3-member committee which was constituted during that time to draft a national road safety policy. He was leading that. Then after that, in 1995, 2010, 2015, various national road safety councils, he was a member. Moreover, in 2011, as part of the National Road Safety Council, when a working group was established, 4 working groups were established, he was the chairman of the working groups on education for road safety. So somebody who is having the vast experience in the area of road safety and leading us and guiding us to work in this area. We are extremely happy that he is attending the webinar today. And I invite Mr. Mehta to deliver the opening address. Over to you, sir.
Thank you, George. I hope I'm very audible.
Yes, sir. Yeah.
Good. I'm very happy with the opening remarks that you made in terms of outlining the pathetic situation that we have. That in spite of all the efforts that we've been making for many, many years now, that we've got a new Motor Vehicles Act with very stiff penalties, etc. Some states have still not been very comfortable with it because of some populist pressures. But what I can narrate to you is a taxi driver in Delhi once telling me that nowadays he has become very careful because the taxi owner has told the driver that, look, he's not going to pay fines of 5,000 rupees. These days the 500 rupees fines have gone. So you better drive very carefully and don't break any rule. So I did see in a microscopic manner at least some impact, and I'm sure it is maybe anecdotal, but overall we did find a lot of things. Now, you mentioned about the fact that heavily involved in developing a road safety action agenda, being a member of the National Road Safety Council and steering with the group on road safety education. We also prepared the composite report of the all the 4 working groups. And that, I think, was the first time in India that a national road safety plan was made. Now, as you know, as friends would know in the audience as well, that implementation is always a big problem in our country. And therefore, many good things which we recommended could not be done. We could not even get a National Road Safety Day, for example, in order to focus attention. I mean, you have days to focus attention and so on. That's beside. But one of the things that we realized in education, the group on education, was that you can educate, but at the same time, it must be accompanied by enforcement. Or the other way, that enforcement must be accompanied by education. One cannot go without the other. I mean, we saw Delhi traffic police under the leadership of one very smart joint commissioner, one Mr. Garg, carried out a lot of innovative things. For example, traffic constables are handing out roses to riders so that they could follow the rules in the manner that should be done. So that had a signal effect in the sense that there was a study done in the traffic scenario in Delhi, and they found that the accidents are coming in. Now, one of the biggest problems, there are a couple of major problems. One is that 80% of the accidents are caused by drivers, as they say. And overall, the road accident costs nearly 3% of our GDP. It's a huge effort. Other than the fact is that there are a lot of corollary side effects like social and difficulties, etc., etc. But how do you deal with the driver's fault? That is something which requires a more focused attention. Other than education, studies have shown that many drivers can't even see very clearly. They require spectacles and so on. The other problem is drunken driving. Now, there have been various issues around drunken driving, including a Supreme Court order. This is not a very rational order that 500 meters from the center of the highway state, and there should be no liquor shops. Now, what prevents the driver from buying liquor anywhere, or even having, consuming other intoxicants? So these problems continue to have there, and therefore what is required ultimately is better enforcement. We unfortunately do not have very clear understanding about what enforcement requires. You drive on a highway, the rules say that a heavy vehicle will not drive on the center of the highway, but you'll find them occupied on all. If there are 3 lanes, all the 3 lanes are occupied by. So, and while smaller cars will go around zigzag driving, etc., etc. What is very clear is that we require to expand our enforcement. If you're looking at the cost being 3% of GDP, I'm sure 1% of GDP can be invested in road safety. Even if 1% is invested in road safety, you'll find the death rates coming down drastically. So that is what I would urge George and his colleagues to work upon, is to how to get the kind of money which is required to be invested in road safety. I'm talking about investment. It's an investment in human lives, investment in development, investment in human capital. So it is not something which has to be looked at in a very light manner. With that, let me welcome all of you once again to this webinar, and we hope that a series of such conversations helps to build up the narrative. It is not as if one webinar is going to make any difference, but a series of discussions, whether it's media or webinars or articles, including the way we chat at home or with our children, etc., etc. Thank you very much.
Thank you, sir, for sharing your thoughts and bringing many of the key points to our notice. One, you have mentioned about the need for a National Road Safety Day. That is very much needed, and I think we need to start the advocacy for that. Second thing is you also had underlined that enforcement can't happen without education, and education should follow the enforcement, the relationship between both of these things. And you concluded by saying in the road safety sector, not only for awareness generation or education, even for building the infrastructure, the sufficient budgetary allocations for investing in the road sector. Thank you, sir, based on your vast experience, for sharing these thoughts. Now I move to the next speaker. We also were informed that we were expecting some members of the parliament who are the members of the Parliamentary Standing Committee on transport to join with us. But at the same time, in a short notice, it seems that the Parliamentary Standing Committee is meeting at the same time, starting at 3 o'clock. So some of them might be joining later, and they have informed us about that. But moving with our agenda, now I would like to invite Sri T. Ilangovan, who is the Executive Director of Kerala Road Safety Authority. Before taking up this position as the Executive Director of the Kerala Road Safety Authority, he also was the Director of the NATPAC, which is the National Transportation Planning and Research Center. He is having 35 years of professional experience in research and development, and he is leading the Kerala Road Safety Authority now. And also, for the information of the participants, Kerala Road Safety Authority is the first authority came into existence in this country way back in 2007. Sir, I would like to invite you, and also would like to raise a couple of questions to you. Earlier, I have mentioned after the enactment of this law, overall, taking about 10 states, major states, the road safety accidents had come down by 10%. But during the same period, Kerala have not shown any reduction in that. There was a 4.9% increase during the first 6 months after the enactment. But the positive sign is, the first 6 months of this year in 2020, Kerala had shown a tremendous improvement, and comparing with the same period last year, Kerala could save about 1,045 lives. That is a big percentage comparing with the last year death happened during this period. So, we would like to hear from you what are the measures that you have taken, because initially there was a delay by Kerala also for implementing the enhanced penalty and all. That might be the reason for the initial increase. But after that, what are the measures taken by Kerala which resulted in a reduction? My second point is tell us also about the functioning of the Kerala Road Safety Authority. I was just reading 2 days back, based on the recommendation by the Road Safety Commissioner, the Kerala government is going to amend the Kerala Road Safety Act of 2007 and to empower the Kerala Road Safety Authority. That means all the RTOs, everything related to road safety will be coming under the Road Safety Authority. Tell us more about what are the measures taken by the state of Kerala in reducing the road accidents and the death, and specifically, also tell us, about the functioning of the Kerala Road Safety Authority and some of the challenges that you have faced in managing the Kerala Road Safety Authority. Over to you, sir.
Thank you. Good afternoon to all of you. It's nice to join you in this webinar and to share my views on the post-pandemic as well as post-Motor Vehicle Act amendment period. I can classify it now. I think almost 1 year has passed since the Motor Vehicle Act amendment, September last year. I have information and data before me for the last 12 months. And I would classify this period as 4 phases. The first phase is this initial hiccup period, September to December period. In fact, that period is the one where we sensitize the whole amendment to people, creating awareness and various sensitization measures through IEC programs. And we did not go for enforcement immediately. So the first 1 month was just only an awareness creation period. So the record shows that there was not much reduction or no change in the accident scenario as well as in fatalities. Of course, we registered about 2% reduction in the death during that period. That was immediately after the amendment. Coming to the first phase, January to March of this year, that was the period where we had the full amendment and we had the enforcement mechanism. We have a dedicated force called Save Kerala project. So under which all the districts in Kerala will have one RTO who will look after the collection of tax, permit, and all those things. And the other RTO's job is to enforce the road safety. So there is a team of about 250 motor vehicle inspectors spread all over the state enforcing the road safety. And during these 3 months, January, March 2020, we were able to reduce the death rate by 17%. 17% reduction in the fatalities and about 4% reduction in the number of accident cases that are reported. And the third phase, I would say, is the pandemic period, April, May. That's where we had a total lockdown. And during this period, of course, the movement of vehicles were restricted. Only emergency vehicles were there and few people who had to go out. So we could see that data shows that about 90% reduction in the accidents as well as fatalities were registered during this lockdown period. That means 10% of the accidents were reporting during that period. You would wonder why accidents take place when there is a lockdown, total lockdown. Of course, the emergency vehicles were zooming past on the road and there was no control on the traffic. So no signals, no policemen on the road. So tendency of overspeeding was very much prevalent during this period. Then I would say that May is a lockdown period. April, May put together, we were able to reduce the fatalities by 75%. Fatalities and accidents by another 74%. So this is the period, lockdown period. I would say the next phase is unlock period, starting from June. And we have a data showing that June to August, June, July, August, during this unlock period, the number of accidents have come down by 40%, the fatalities by another 42%. So there is, if you compare the post motor vehicle amendment period into two phases, one is immediately after the amendment, then full enforcement mechanism in force, then lockdown and lockdown. During the entire period, we were able to reduce the accidents by 30% and deaths by another 30%. So 30% reduction in the accident severity was recorded during this entire 1 year period, 12 months period. And that is one thing. Second thing, there are other negative impact also, positive impact also. During this period, this reduction has enabled us about, there are about, more than 1,000 lives were saved. 1,000 lives were saved. Another 12,000 injury cases, 12,000 injury cases were, avoided. And this has helped our medical resources to be redeployed for these pandemic-related activities. That has, in a way, helped us to bring down the death rate as well as reduction in corona cases. So this is in nutshell we have achieved. So overall, during the normal period, our reduction in accidents and fatalities were about 15 to 17%. And during the pandemic period, it was about 40% reduction in Kerala. Coming to the next aspect which you wanted us to share is the functioning of Kerala Road Safety Authority. Of course, all of you are aware that this is one of the first authority created in the country. It has been there for last 13 years, and we are trying to improve every stage. Now, currently, we are in the process of amending the Kerala Road Safety Authority Act, because the original act did not emphasize a dedicated force to support the enforcement within the authority. Now there is a move to bring highway safety, road safety, as well as road safety related to major corridors under the purview of Road Safety Authority. So they will functionally report to the Road Safety Commissioner, but administratively they will be under the police or motor vehicle department. This is what we are intending to, and we are also trying to create a technical strength to Road Safety Authority, because the original Road Safety Authority emphasized only a selective staff of administrative personnel, just managing the fund. Now we are not only advising the various districts and other stakeholder departments, but also we extend our activities in implementing road safety programs. So there is a proposal before the authority, and the government has agreed to amend this, and that I think it will take soon, in another couple of months' time. And about the major programs which we support every year is funding the various stakeholder department for improving the black spots. We have identified about 238 high-risk black spots in the state. So funds are allocated to PWD and other road agencies for carrying out short-term and long-term rectification measures. Then during the Sabrimala season, the state records about threefold of traffic on some of the corridors. About nearly 400 kilometers of roads are subjected to at least 200% traffic, and the traffic mostly come from outside Kerala. So, in order to maintain, in order to reduce the pile-up accidents due to this overcrowding, we have a program called Safe Zone Sabrimala. This we have been doing this for last 10 years. In 2010, we started this program, and every year we are improving upon. So the motor vehicle department and police will be on the road 24/7 and try to sort out wherever there are pile-ups of traffic, and wherever people are in distress due to accident or any other reasons, they are immediately taken. So emergency services, providing mechanical facilities for standard vehicles. So all these things are carried out during this season of the Sabrimala season. It's about 65 days, starting from November, middle of November to middle of January. So this season, last year, we were able to bring down the fatalities from, normally the accidents do take place, but it does not get reported during that time because of the hassles. So our motor vehicle department as well as police people rush to the spot, sort out this. If there is any mechanical problem, they try to rectify it. So all these things are done during this Sabarimala Safe Zone project. So these are some of the activities apart from Safe Zone project, which is mainly 24/7 monitoring, patrolling of our highways, that is going on for last about since September last year again. So these are some of the reasons which I would attribute the reduction of the fatalities as well as accidents in the state. Yeah, thank you.
Thank you, Sri Elankovan, for explaining to us, how you were able to reduce the road accidents and the fatalities in the last 12 months by dividing that into 4 segments, especially the last 3 months during the unlock period, achieving a target of a reduction of about 40%, and also for explaining us about the functioning of the road safety authority. As you know, this central motor vehicle rules is notified and came into effect from 1st of October. Some of the key highlights of these rules are, one is, for example, the electronic monitoring. Even the vehicle documents, now we can store it and there is no need of carrying the physical documents in any of the vehicle. And the e-challans and things like that, digitalizing and using the electronic mechanism for electronic mechanism. So can you tell us whether Kerala is already prepared to go ahead with these specific highlights of these rules? That is number one. And second one is, as I mentioned earlier, what is the purpose of this new amendment? Because as I could see that all the 85 enforcement squad, 14 control rooms and 14 motor vehicle inspection manning people, 14 RPOs, everything will be coming under the road safety authority. So what is the purpose of that? Whether it is due to the coordination issues present, and how you think that this new amendment, which is expected to come into force in the next few months, will further help in taking forward the road safety agenda? Over to you.
Okay. First thing is about the digital enforcement. Kerala is far ahead of other states in digital enforcement. We are the first state to start the digital speed control system by installing automatic number plate recognition camera systems. We have about more than 300 such cameras spread over our highway network, and that detects overspeeding as well as the red light jumping activities. Both police and motor vehicle department are monitoring that, and they have a control room, centralized control room. For motor vehicle department, it is at Cochin, and for police department, it's in Trivandrum. Now, the Safe Kerala project envisages control room in each district, and each district will have a RTO enforcement, and his team will concentrate on the road safety management, road safety enforcement activities. And they report to the transport commissioner by virtue of because they are appointed by the government, they are under the transport department. We as a road safety authority, we cannot control them physically. It is only through the motor vehicle department we can get our work done. So what it was felt is, whenever there is a major accident, we are just mere spectator only. Only the motor vehicle department or police are doing it. Whereas we provide funds for operating these operational expenditure of these programs. So it was felt, in fact, one of the commission of inquiry which inquired into frequent accident situation in the state, it recommended a dedicated workforce of uniformed personnel under the road safety authority. They will report to the road safety commissioner, who will in turn functionally monitor their thing. They will, of course, they can be under the concerned police department or motor vehicle also. So this was being felt on many occasions wherever there were major accidents reported. Another thing is that the present rule or act does not give many powers to the road safety authority. Road safety authority can issue orders or notices to remove cause of accidents, remove obstructions that cause accidents or endanger the life of people. Apart from that, suo motu, road safety commissioner cannot issue any other order. So it all has to be done through police or motor vehicle department. Even advertisement, wherever there are dangerous advertisement hanging on the road, road safety commissioner cannot do that. So High Court also intervened on many occasions to channelize this. So we felt a need to have some certain modifications or amendments in the act. That process is now with the committee of secretary, transport, finance, law, and motor vehicle department. They are now looking into it. Coming to the digital enforcement again, we are again from October 1st onwards, the digital record system has already come into effect in Kerala from 1st of October. So one need not carry any documents physical form. They can put it in the DigiLocker system, and that is enough. So that has been implemented, and the GPS systems for all commercial vehicles, all heavy vehicles are in place, and we are also using this artificial intelligence and machine learning system for detecting the violations. Now, along with the camera, we have this artificial intelligence systems embedded machine learning system, wherein you can detect the helmet, rule violation. You can detect cell phone use violations. You can detect seatbelt violations. All these things are from a single camera. One can get a series of violations detected. Earlier, it was only the speed detection was emphasized. So this is done. Now we have also created many safe road corridors. Especially from Trivandrum to Central Kerala, Adur, we have created about safe demonstration road corridor, and with all facilities, enforcement facilities, and that is also giving good results now. And we are also in the process of creating safe road corridors in 5 other regions, 5 different districts. So these are some of the programs, I think, which we are supporting it through World Bank assisted funds. We are trying to implement this in Kerala. Yeah. Hello.
Yeah, thank you for explaining to us how Kerala is well equipped to implement the central motor vehicle rules with the electronic monitoring and the cameras and all. And also you have mentioned how the new amendment will give further added strength to the Kerala Road Safety Authority in coordinating everything related to road safety. We will come back to you with more questions later. Now from Kerala, I am moving to Rajasthan. We were expecting the cabinet minister to join. Unfortunately, he could not join it. We have the Rajasthan police, the SP, the superintendent of police in the headquarters, Dr. Amarda Duhan, with us. Dr. Amarda, are you there?
Good afternoon, sir. Yes, I'm right here attending these
good
webinar.
Afternoon and welcome to the webinar. I will start with specifically asking 2 questions to you. One, as in the beginning, as I mentioned, in the last 6 months of this year, Rajasthan could make a reduction in the fatalities. We could save 1,609 lives. So what are the measures that you have taken after the enactment of the law which resulted in saving the life, or whether it was just simple the impact of the lockdown? So you can tell us more about that. Secondly, as I already discussed with the Kerala Road Safety Authority, the central motor vehicle rules also came into force from 1st of October. So how Rajasthan is equipped to implement this act and the law? Over to you, madam.
Good afternoon, everyone. I would first like to express my gratitude to Pets International, who's given me the opportunity to represent Rajasthan state on this platform. the MV Act, MV Act came into force in 1988, which replaced the previous old MV Act, which had come into effect in 1914. So the new, or the MV Amendment Act in 2019 was a logical step, next step. I'd like to, whatever the two questions which you've put before me, I'd like to encompass it in my next I'd like to cover those topics in next 7 minutes. First is I'd like to discuss the MV Amendment Act 2019. So it is, I think it is a way forward and the next logical step. In this, there's certain major changes which were brought into effect. The first and foremost is the increase in the compensation, monetary compensation. In a land where the number of accidents worldwide, they're maximum in India. Although we have second highest population, but still the number of accidents in India is the maximum worldwide, where we, it costs around 3% of GDP, which is a huge amount. We have 5 lakh accidents approximately every year, where 1.5 lakh people die and many more get injured. So increasing the monetary compensation, it was a major deterrent. It is a major deterrent and a motivation for the people to follow the traffic rules. And along with that, in this we have the onus on the vehicle manufacturer for the faulty manufacturing, as well as, because nowadays, earlier it was thought upon that the majority of the accidents, and although it is somewhat true also, that majority of the accidents are because of the fallacy of the driver. He has committed some, because of his ignorance, his fault, so the accident happens. But nowadays, we also see that it is because of the road engineering. There's defect in the road engineering also. And this onus falls on the contractor also, which is very nice. And along with the making of the setting up of the National Road Safety Board, which is also a very good step. Talking about the fatality, which is decreased in the last 6 months. I'd like to bring into the notice that although this MV Amendment Act came into force on 1st September 2019 by the central government, it was notified in the state of Rajasthan on 8th July 2020. And after that, after its notification, because during that time, the corona had already widespread, it had spread its tentacles everywhere, and each and every segment of the society was affected by the corona, not only socially, but financially also. So what the Rajasthan government and the police headquarters, along with the transport department, they did was to conduct a major awareness drive from 27/7/2020 to 28/2020. So it was a major drive for around 1.5 months. And, just to create awareness amongst the people that now you will be charged according to the new modified monetary compensation, and you'll have to pay it. That was a major challenge too, and that was the, I think, most important thing to do also, and especially seeing the corona epidemic, which has affected each and every one. This helped us, and from the police headquarters, the notification to follow the new MV Act was issued on 25/8. So I do not have statistics to compare the pre and post MV Amendment Act 2019 effect on the Rajasthan traffic or the fatalities. But I'd definitely say that this did the awareness program and the media help in creating awareness lots in the minds of the people, that as soon as this new act comes into play, it is notified in the state of Rajasthan, then you'll have to pay a heavy price. And Rajasthan is one of the states in which the GDP is not very high. So the normal level of the financial level of the people is also not very good generally. The liquidity in the market or in the hands of the people, of the common general people during the times of Corona is also very. The lockdown was also enforced strictly in the state of Rajasthan, and we were way ahead in handling the cases of Corona. During the Corona epidemic, the lockdown did play a major role in decreasing the fatalities. But the deterrence effect of this Amendment Act also played a huge role. Well, and along with that, I'd like to point out the certain difficulties or the challenges as a police we face while after it was notified that we'll have to take the compensation, the increased compensation according to the amended act. So the challan has drastically, the number of challans they have reduced. They've reduced because of the reduced number of traffic because of Corona. They've reduced because of the awareness, and they have increased the problems of the traffic staff, traffic policemen. Because as soon as this large amount is charged to a common general man, who is from the low or middle socio-economic class, in which sometimes the fine even increases to more than the value of the old vehicle they possess. So, and asking them to shell out minimum rupees 1,000 from their pocket for any of the challan. So that creates a very law and order, small law and order situation on the road, where every time a challan is prepared, the policeman comes at a fix. So the people, they're not they're not ready to pay the challan. They do not have the money. They do not have enough money to pay for the challan, and hence we have to compound the vehicle. We have to seize the way. We cannot compound the challan there and then because of they do not have money, and then we have to seize the vehicle. Number of vehicles being seized have increased to drastically new level, and we do not even have spaces in our police stations to keep them. Moreover, drunken driving, we cannot, during Corona times, we cannot even act on the drunken driving. And the rage has amongst the people that, occasionally we face that rage. But we are very adamant as a police force that we will, in the times to come, we will enforce this new Amendment Act very strictly. We are in the process. But we would want the people to understand along with the awareness programs. We'd want people to understand better that it is high time they'll have to, it is better that they enforce it with their own will rather than being enforced upon them forcefully. That will be for their own benefit. The states which had already enforced it before the Corona times, they did not face such difficulty. But in Rajasthan, we had a different experience while enforcing it during Corona times. We faced the unique challenges, and we are handling them in a very well and very planned way. The Central Motor Workers rule also, as and soon they get notified in the state of Rajasthan, we're preparing for it, and we will be enforcing it as per the law, as per the need of the hour. Along with, we'd want to take along with the general population, the general people along with us, because whenever an act comes into force, the main intention of that force is not to get the monetary compensation or to fine the people. The main focus or the main aim is that people follow traffic rules, the casualties are decreased, the fatalities are decreased. Because when a person is killed, whether it is in a murder or in an accident, the effect or the impact or the repercussions of that death is the same on the family. So we take it as seriously as a murder is taking place, and we act upon it in various effective ways to decrease the casualties by implementing the new Amendment Acts and by taking people along with us in each and every. Thank you so much.
Thank you, Dr. Amrita, for in detail explaining to us the measures taken by Rajasthan. As you mentioned, the enhanced penalty, 63 clauses which was notified on 1st of September. Rajasthan had notified that on 8th of July 2020. Of course, there was a delay, but you have explained how the state had moved forward in implementing that. You also mentioned, the resistance faced by the enforcement officers on the road due to the enhanced penalty. So I have a couple of more questions. One is whether you have taken any measures in educating the people, maybe involving the civil society organization also about the enhanced penalty, and also you don't violate so that you don't need to pay the enhanced penalty. I was mentioning earlier, still many people, they are simply wearing the mask, but not the helmet. They are more afraid of, corona, but, losing their life. The second thing is regarding overspeeding. One of the main reasons in Rajasthan, it shows almost 70% of the accidents are due to overspeeding. The national average is only 60%. So to control this overspeeding is very much required in reducing the road accidents and the fatalities. My third question is, I'm aware you are also a MBBS doctor coming from the medical field before becoming joining the police. So that is about the Good Samaritan guidelines. That is also notified from 1st of October. Earlier it was only a guidelines. Now it is legalized as part of the amended act. But still we can see the onlookers, instead of helping the victim, taking using the mobile to take the pictures. Second thing is, when we are taking the victim to the hospital, they also are reluctant to admit, other than the medical college, SMS Medical College and all the private hospitals, they keep asking 101 questions. The third thing is, the person who is carrying the Good Samaritan, you won't be asked any questions and you don't need to even reveal your name. But still, people are afraid, and that is not the condition. I was last year in a Good Samaritan even quoting the person who had reported to the Delhi police about Nirbhaya was summoned 36 times, and even he lost his job because he was working in a private courier company or something. Every other day, Delhi police is at the doorstep, he lost even the job. So that is so we need to sensitize the police force as per this law. We need to sensitize the hospital, and also we need to educate the onlookers on road. So any special focus on this issue? How you think that we will be able to take forward? Because this is one of the issue cuts was working for the last several years. Earlier it was, we call it section 134 of the MV Act. Now it is the Good Samaritan guidelines. So we would like to hear your response on some of these issues as well. Over to you.
The first question was regarding educating I do remember it. That is regarding the involvement of the civil societies and all in creating, and that is what I told you in the first 1 month after it got notified in the state of Rajasthan. We focused upon the awareness part, and it is not that after 1 month we've stopped it. We are continuously involved in it. Police is always resource scarce, as well as it always faces a staff crunch also. So we cannot do it unless and until we involve all the civil societies, the NGOs, and we do take their help in creating an awareness. We cannot reach everywhere, but along with their help, we reach to the far end of the society, we reach to the far end of the people, and we try to create the awareness. So yes, we are involving them in our awareness drive, and we will continue doing so. Rajasthan is very, a very good trend of even we are including this in the awareness drives. When many companies, many banks, they come forward in in helping us in these awareness drives under CSR also. So we are working on it and will work on it continuously. Second is overspeeding. Yes, I agree that most of the deaths, and especially in the state of Rajasthan, they have been attributed to overspeeding. And we have national highways, but because, and one of the main things, because the state of Rajasthan is the condition of highways is very good here. And hence the people they tend to overspeed on these roads. But, we have increased the number of highway patrolling. We have increased the number of interceptors on the highway. The numbers have significantly increased. Along with that, we have already sent a proposal to increase the number of personnel deployed in those so that we can run it on a 24-hour basis. Because of the shortage of staff, we couldn't, that is a limitation, but we are working on it. And in the times to come, you'll surely observe that the presence of the highway patrolling, the presence of the medical the emergency ambulance, the presence of, along with the NHAI medical services or the staff, we are working along with them and we are making a presence felt on the highways so as to control the overspeeding by interceptors, by controlling our own police force, of making them realize the importance towards the duty they are performing. So, and moreover, in the state, under the smart city projects and otherwise also, we are, in form of this digitization or following newer methods, we are installing the new age CCTV cameras, which can detect the red light violation, which can detect the overspeeding. And we have moved on to the artificial intelligence traffic system. So we are working on it, and we are working on it in a very speedy manner. So in times to come, because these things take time to materialize, we have already sent the proposals. The proposals have been sanctioned, so they'll come into effect in a short while, and we'll shortly see improvement in the in the cases we challan on overspeeding, in the mentality of the people, along with the decrease in the deaths due to overspeed. The third question, and I agree fully with you about the Good Samaritan law. Even our own police force is ignorant to it. There's a need to create, there's need to create awareness about it on a police staff level. The second is, we'll have to take, we'll have to also involve the medical professionals along with it. We're creating a golden hour app. We are also working on the IRAD, which is Road Accident Database collection, along with the IIT Chennai team. They are holding it on a project basis here, a pilot project basis in the state of Rajasthan. So, and in that, the people of, the transport, the police and the medical, they come on the same platform, and we'll able to manage ourselves better, and will be, it will be a good communication. The communication gap will reduce. On that platform, we'll also include this Good Samaritan law. We'll try to create awareness about it amongst our own police staff along with the medical staff. And then we'll reach, the second step would be to reach to the people and to make them aware. We have prepared these hoardings, and we paste it on each and every police station, so that the people who come there, they learn about it. The police staff that is well versed in it. Whether that we take the help of the social media as well as the print and print media, electronic media, in creating awareness about it. And hopefully in times to come, each and every person will know about it. Thank you.
Thank you for elaborating all the points and the measures taken by Rajasthan Police and the Transport Department in addressing all those issues. We give you good wishes in all these initiatives, and we will be happy to work with you and support the efforts of Rajasthan Police in addressing the accidents. Like I mentioned earlier, unfortunately, we don't have any members of the parliament or the cabinet minister in Rajasthan joining with us today. I hope we can come back with another webinar involving them due to the sudden scheduling of the Parliamentary Standing Committee and some engagement, urgent engagement with the Minister. So before I invite my colleague for summing up, I request Sri Ilangovan also, you have anything more to share in any point? Otherwise, sir? Sir, you need to unmute.
Yeah. Can you hear me?
Yeah. Now we can hear you.
Yes, sir. Yes.
Okay. Now, after listening to Dr. Amrita Dua speak, I just wanted to add some points regarding this COVID pandemic has created a lot of problems for road safety management in our state. Especially, I think more people wear masks. We can agree. I had a statistics before this Motor Vehicle Act amendment. What was the complaints level of various key indicators of enforcement and what it is now? I just wanted to tell you, Kerala is, we have about more than 80% of the people in the state, they wear helmet, they use seat belt, and about 10 to 15% of the people still use cell phone while driving. So this was the situation. Now, after this COVID lockdown, this level of complaints has come down. In fact, it's increased in rural areas, whereas in urban areas, the level of complaints of helmet rule violations or seat belt or drunken driving all have increased. So this is one thing which we noticed. And in fact, we had earlier achieved a level of 90% plus for seat belt wearing as well as helmet. Only pillion riders, they were reluctant to wear. We reached up to 40% of our pillions wearing helmet while riding, whereas 90 plus % of the people riding the bike, they wear helmet. Now it has come down. As people give priority for their own health than these risk factors. So that is one thing which I just wanted to add. Regarding the trauma care side, I think we failed to include. We have recently introduced integrated trauma care services in the state. We have more than 2,000 ambulance services operating in the state of Kerala. Apart from the 350 ambulances for the entire state, operated with a single number, 108. We call a system called Kaniv. Kaniv is 108. So that is implemented during the last few months. And we also have started this cashless treatment for accident victims. We went ahead, but unfortunately, the Government of India has come up with a scheme as part of the Motor Vehicle Act amendment. So we dropped our things. Our aim was to provide cashless treatment to anybody who is involved in an accident up to 50,000. Now with the Government of India's scheme, MOT scheme coming up with the draft and all that, so we dropped that idea. And we are also introduced school curriculum, introducing road safety lessons in school curriculum from next academic year. As a part of that, we have prepared a handbook for teachers. During the summer vacation, we wanted to impart training to all our school teachers. Unfortunately, the COVID pandemic taken away the opportunity from us. Probably after the COVID subsides, we will resort to that. So we were originally thinking from next academic year onwards, the road safety lessons would be taught to all our children up to +2. So that we are also into this. Then another point which I wanted to, I think IRAD was mentioned by Dr. Amrita. I think they are now piloting it in 6 states where the accident fatalities are more. And probably then the next stage, when there is a nationwide rollout, Kerala also will be there. But we have created our own software solutions for integrated database management with the Government of India coming up with their scheme. So we are now going slow in our IRAD similar IRAD software solutions. we have a software called Rapid, which complies with all the tables that are required for Government of India, National Crime Records Bureau, and the Ministry. But now with the IRAD coming into position, I think we are slowly going away. That was actually in-house built software solutions we have developed, and it's there in operation for last 5 years. I think these are the points which I just wanted to share with the participants. Now, thank you. Thank you.
Yeah. Thank you, Sri Elangovan, for adding a few more points, especially the positive impact of the pandemic upon road safety. That's more and more people wearing helmet, the riders and all. That is really a positive impact. And also, telling us about the cashless treatment, handbook for the teachers, the integrated data management, Rapid and all. Thank you once again, Sri Elangovan, and also Dr. Amartha Duhan. Now I invite my colleague Madhusudan to sum up and to propose the formal vote of thanks. Over to you, Madhusudan.
So thank you, George. George, if you permit me, I want to flag 2 or 3 issues which are coming in my mind since we are working in this sector. And after hearing the Dr. Amartha and Mr. Elangovan, I want to say to ensure the road safety in the post-COVID or post-2019 MVA era, I think the political will is very, very important. And as we have done the state comparison of institutional capacities and the legal framework earlier, in 5 states and few UTs, union territories, we found that in all the states there are several committees, and I think Rajasthan is far ahead in having the road safety committees, starting from chief secretary to district level. Or in Rajasthan, we are going even one step down, and we are having road safety committee at sub-divisional level, at SDM level in each tehsils. So I think there is a strong felt need to revive all these committees or strengthening this the capacity of these committees. Second thing is like cross learning. Either it is strengthening the district road safety committees, or the state action plan, or strengthening the road safety policy on working. And we were planning to discuss all these issues with Mr. Minister Pratap Singh Khachariawala. I think these are the needs of the time. Now I want to summarize today's discussion. Though we could not have a minister and the MPs, they were busy in some meetings. But I think we had very good discussions on. I think this webinar gave us a very good overview of the road safety and the journey of Motor Vehicle Amendment Bill 2019. George has given wonderful overview of this journey, and he also offered or gave us about the accident data and the pandemic effect on road safety, everything. Then we also came to know through this webinar the importance of having a National Road Safety Day. That how it will be contributing in the changing the road safety scenario, and we also came to know the changing behavior of drivers on the road. Like we example Mr. Mehta gave about changing behavior of drivers in Delhi. And then we came to know about the vast experience of Mr. Elangovan. We all greatly benefited from his experiences, and I think he offered very good lessons from other states also of having a road safety committee, and how how it can the other state initiatives which are leading and contributing and ensuring road safety. And then we also heard Dr. Amrita ji. I think she shared very good experiences, insights, and expert the views she shared, and we greatly benefited from her views. And I think it's a wonderful experience she shared with us. So with this, I want to thank all the panelists. First, I want to thank Mr. Mehta for joining us and enlightening us. I also want to give our heartfelt thanks to Mr. Elangovan ji and Dr. Amartha Duhan ji. And I also extend a word of thanks to all the attendees and all the other team members and GRSP members who joined us. and all the road safety networks who gave us their cooperation and suggestions for this webinar. So thanks all. Thank you.